So you've done a lot of this work over the years of helping enable people. As you've gone through those 35 years then, I mean, what's some of the biggest lessons that you've learned from transforming these organizations and helping enable people?
One of the most important lessons is we refer to don't pave the cow path. And that is to say that if all you're doing is layering the technology on top of the work that you already do today and not actually taking the time to rethink how that work needs to be delivered, then you're going to really run yourself into the ground. And I'll be honest, I mean, I've been an executive that's done that. You know, we follow the path of least resistance. And in many cases, part of the challenge is that while we're a very expensive and a very large industry, we don't have a lot of expendable resources. We don't have a lot of expendable dollar resources, and we don't have a lot of expendable people resources. And therefore, what oftentimes is you just try and figure out what's the quickest path from A to B. And you don't take a whole lot of time to figure out how to optimize or improve or redesign the process that you're working on. And if you look at healthcare and you look at how you take care of yourself or how an appointment works, it's no different than when you were a kid, right? I mean, it's the exact same process. We've just added some automation around the edges, but otherwise it really feels the same, with the exception of how I think things have really transitioned over the course of the last, probably started 7 to 10 years ago, but really we're seeing the majority of that transformation really starting to take place here as few as the last 24 months.
There's been a huge amount of change in the healthcare industry across
Absolutely.
the country and through the world over the last 24 months. I mean, yes, the pandemic has affected a lot of that, but it's not just been the pandemic that's done it. It's a change in the patient behavior.
I think it's partially the change in the patient behavior, but I also think it's part of the pressures that are coming from other industries getting their feet more into healthcare because they see an opportunity and they're going to take advantage of those opportunities as best that they can. It adds an interesting challenge to the work that we are doing, but it also creates a competition that didn't necessarily exist 5 years ago. So up until 5 years ago, we could ignore it. I'm here in Springfield, Illinois. It didn't really matter to me what Gensinger did or what Cleveland Clinic did or what BJC down in St. Louis. I started to pay a little bit of attention to. Memorial around the corner was somebody that I always was paying attention to. But now I got to worry about Apple and I got to worry about Amazon. And I got to worry about Google. Those were never things that anybody would ever think that they would ever have to compete against, right? And now I'm competing with them in healthcare as well. Not just for services, for people in some cases. That's part of the challenge.
That's been one of the biggest challenges over the last 24 months. You actually hit something there just because Apple, Amazon, some of these larger companies out there, they have the ability to reach into our organizations and change the way we have to do things, because they've found a niche or a need, or somebody got somebody hired and created a new product for it.